to see all of you. Hope you're all keeping well.
Absolutely.
So these times have been difficult for all of us, and all the numbers that we see in the news are worrying numbers, too much numbers. So today I will show you some good numbers which will make you happy, as Dr. Madhu was saying, which will make you a little proud. So being in CMS for the last 5 years, we have analyzed a lot of our patient data, short term, medium term, long term, and it's all published. So it's right in front of you to see how most of our patients have done. So quickly in 5 minutes, I will show you the important results which are there in literature and how they are different from other centers and other world hospitals, and how our patients have actually done well. So whatever I'll be showing is out there, and it is all of our patients' data. So how have our patients been doing? 2 years back, we published a paper, and this was of operated patients in 2013 when they had completed 3-4 years of follow-up. And how much weight did they lose? So you see excess weight loss. Excess means extra weight. Like if your ideal weight should be 70 kilos and your weight before surgery was 120 kilos. So your excess weight was 50 kilos. So how much weight do our patients lose or did lose after surgery? At that point of time, mainly we were doing sleeve gastrectomies or gastric bypass. Most of you all must have undergone one of these two procedures. Now, on an average, 1 year after sleeve gastrectomy, most patients, so this is an average number, most patients lost 88% of extra weight. So if your extra weight was 50 kilos, you lost about 40 kilos after 1 year. In after gastric bypass, your weight loss was a little more. You lost almost 100% of your extra weight. This happened with most of the patients. As the surgery duration increased from 1 year to 3 years, the weight loss after sleeve was still 70%. So 72% extra weight has still been lost. And after gastric bypass, it was 86%. Though these numbers seem different, it's not that there is more weight loss with gastric bypass. It was just something that was found. Dono ka difference is not that much in true sense. The difference is not what we call significant difference. But yes, if you compare this with data from other centers or other hospitals, they would have lost less weight. And it's there in all the papers which are published. So definitely our patients who have been operated, who have been following up 1 year, 3 years, this is the kind of results that they have been achieving. Now, recently, we went ahead and we wanted to see long-term results. Like how have they been doing? Okay, first year, everybody is losing weight. By 2-3 years, everybody is more or less at the same pace. But has the surgery given you good outcomes even in long term? So this is data of patients operated in 2012. So some of you who had surgery in 2012, last year or last to last year, either me or Dr. Madhu or our dietitian then must be calling you to check what is your weight, please come for follow-up, all those things. So we analyze that data also. This is also published. And after sleeve gastrectomy, even after 5 years, 70% extra weight was still lost. Means you were still lost out of 50 kilos, 35 kilos extra weight was still lost. So you were maintaining well. Similarly, after gastric bypass, you had lost 80% weight. You go 2 years ahead, so 7 years. This is the longest we have studied and this is the longest we have analyzed so far. In both the procedures, about 70% extra weight was still lost, which means even at 7 years, a good number of patients are doing well. They are maintaining their weight. They are maintaining their lost weight. Yes, of course, you can see at 1 year, you had lost the maximum weight. And gradually at 3 years, then 5 years and 7 years, it has come back a little bit. But still you are much better than where you were when you underwent the surgery, even 7 years down the line. Hopefully in the next few years, we'll have 9 years, 10 years, 12 years data also. Some of our patients must be older in terms of surgery. So they would be proof that most patients, yeah, there will be some outliers, but most patients are doing well, at least in terms of weight loss at our follow-up rates. And we are having good follow-up rates. Another interesting thing that we were doing across the last year, especially in the lockdown period, was a lot of our patients who had diabetes before surgery, who were operated in 2012, 2013. Dr. Madhu was telling them, get your HbA1c levels and your sugars done, HbA1c and sugars done. Basically, we wanted to see what is their sugar status, diabetes status 7 years later. So this was all done last year or last to last year. Now, patients who had sleeve gastrectomy, after 7 years, 60% of them are not on any medicines. So whatever medicines they had before surgery, whether it was tablets, whether it was insulin, all those medicines are stopped and they are having good sugar control. Means it's not that their fasting sugar is high or their 3-month glycohemoglobin is high. They are all having good control. Similarly, with bypass, almost 1/3 patients are not on any medicines. 10% patients after sleeve, the medicines were reduced. So if they were on insulin and tablets, maybe they are now only on tablets. So the insulin was stopped or the dose of the medicines were reduced. Similarly, after bypass, 20% patients, even 7 years down the line, are not on any medicines or are reduced medicines. At least the insulin injections have been stopped. Yes, there is a small number of patients, about 30 to 40%, in whom the medicines are still the same. Now, everybody behaves differently. Some people who, when they had surgery, they had very strong diabetes, 20 years, 30 years. So in them, the improvement obviously would be a little less. But those who were fresh diabetics, maybe 1 year, 2 years, not very strong, they are the ones who had a very good outcome. So even 7 years down the line, their diabetes has been well under control. Most are without medicines, most are without insulin and having good control. But what I want to emphasize is some patients do get the sugars do get deranged over a period of time. So you should not be under the impression that diabetes is cured. There is no cure. It is still there. We just have to be vigilant because the control is reached. So now, if you should just keep checking your HbA1c periodically as per follow-up, just to see that everything is under control. That's all. But yes, a good number of us are having diabetes under control, even 7 years later. Similarly, many of the patients have BP problems when they undergo surgery. So even 7 years later, about 50% after sleeve or bypass are off BP medicines. BP medicines take a little longer to stop. So those who have recently had surgery and who have high BP, it will take a few months, but definitely over a period of time, 50% go off medicines. There are many other benefits which I have not enlisted here, like improvement in sleep apnea or joint pains. All those things are added advantages, but the main ones, the ones that worry us the most, apart from weight, are sugar and BP. So sugar and BP definitely in a good number of patients, even so many years later, has been well under control. That is the message. But yes, we should not take it lightly that, okay, surgery is done and once the sugar is under control, BP is under control, I can live my life. Aisa nahi hai. Things can come back. So we just need to be vigilant. But definitely if for 7 years hamari sugar achhi thi, we didn't have high sugar. So at least that has added 7 years to our life of diabetes free. So the complications of diabetes, stroke, all those things, risk has also been pushed by 7 years, maybe longer, as we will analyze more data. So this is just something we believe is responsible as to why our results are bit better than other centers' results. The important things are, no doubt, is the diet, like how much we pressurize you about diet and proteins, and in the early period how we are trying to explain to you about portion control eating. This mainly the patients who have recently had surgery would realize it more. Eating 6 chammach, that really helps. So the maximum weight loss of the first year period to a good limit is probably because of following this portion control eating, pushing you to follow up regular diet consultations and blood checkup, and of course support group meetings. So for people where it is difficult to come physically, at least in support group meetings, some ideas are exchanged and you learn some new things. Like Amna said so many things about GI foods, so maybe even I learned a few things today, so maybe I can also follow it in my normal day-to-day diet and lifestyle. So definitely our outcomes have been good, so that is the good part about it. But my message is, still, if you had BP or sugar, you should be vigilant that they can come back. And if you are keeping your checkups regular, then you will be able to tackle them faster.